Hello there, I'm Simil Parikh, radiation oncologist at the Lake Huron Medical Center and head of the Cancer Center. I'm here today to talk about colorectal cancer. Today I want to focus on younger patients. We're seeing a rise of colon cancer in patients that are younger. We're also seeing more advanced colorectal cancer in these patients. This is concerning for many reasons. We're not expecting to see cancer in these patients, so we may not have screened them appropriately. So they get diagnosed at later stages. This makes it harder to cure. This is concerning because it becomes more challenging to treat these patients for cure. If you have localized disease, there is a chance for cure, but if we see you and the disease has spread, it becomes very difficult to treat and cure you. This is why we want you to think about getting your colonoscopy. Let's talk about colonoscopies. Many of you might have seen the actor Ryan Reynolds filmed his colonoscopy on social media. Colonoscopies are something that we fear. It's a camera going into your nether regions. People talk about the prep and people talk about the discomfort. I'm here to tell you, it's not that bad. The prep is challenging, but there's a reason for it. The prep removes fecal matter from the colon so your doctor can get an excellent view of your colon and see any tumors that might have arisen. Without a good prep, you're blinding your doctor. And so that's why we do it. Yes, you're on the toilet all night before that colonoscopy, but there's a reason to do it. The age we do colonoscopy used to be 50. As I said, colon cancer incidence is rising in younger patients, so we've now changed the recommendation to 45. This is a test that we know saves lives. When we catch colon cancer early, we can remove it, give chemotherapy and radiation as needed, and allow you to go and live your life. People really don't like to do it. My patients tell me they don't want it done, and they're not gonna do it. And I tell them, you know what, it sounds bad, but a colostomy is probably gonna be worse. A colostomy is a bag that you have on your side because your colon is no longer there. You know what's bad? Not being able to see your children grow up because you passed away at an early age from colorectal cancer because you didn't want to get your colonoscopy done. I understand the fear and the concern because I have it too. I'm 44. Guess what happens in about a year for me? I'm gonna have to sign up for my colonoscopy. And yeah, I'm uncomfortable about it, but I know it's the right thing to do. I know this is good for me. I know it's gonna let me live longer, and it's gonna allow me to preserve time with my family and my friends. So I strongly recommend that you get a colonoscopy. Please sign up for it at 45. Now, if you have a family history of colon cancer, your recommendation would be different. We recommend that you get your first colonoscopy 10 years before your family member that was diagnosed with it had their diagnosis. So if your father had colorectal cancer at the age of 50, then instead of 45, you're gonna wanna get yours at 40. Just subtract 10 from the first time of diagnosis, and that's when you would get it. Other people may be at risk for colorectal cancer, such as those with ulcerative colitis and other bowel diseases. Please do talk to your doctor about when you should be getting your colonoscopy. The reason colonoscopies are so effective is it is a direct look inside your colon. No CT scan or MRI can do that. There are capsules with cameras in them, but they don't give you a very good picture. Colonoscopies get complete visualization of the entire colon and rectum. This allows us to see any tumors or precancerous lesions before they grow into something concerning. Not only is it diagnostic, but if there's a polyp, your gastroenterologist will be able to remove it, so it's also therapeutic. It is not a new test, but it's one of those that is highly effective, shown to be life-saving in studies, and something that we do recommend everybody gets. Even though we know colonoscopies are effective in saving lives, 30 to 40% of Americans don't get them done. And this is unnecessary loss of life, unnecessary loss of quality of life. We can't be afraid of something like this. This is a quick procedure. The anesthesia lets you pretty much forget that it even happened. Most people wake up after the procedure just kind of wondering where they are and say something funny. After you do the prep and show up for your study, you're going to meet your anesthesiologist. He's going to talk to you for a bit, and then he's going to count down. 5, 4, 3, 2, and before you get to 1, you're gonna wake up, it's gonna be completely done. You're gonna giggle a little bit because the anesthesia can make you feel a little bit loopy, but you're all done, and you're probably not gonna have any discomfort or pain at all. It is a very, very easy procedure once it's done. If you have a clear colonoscopy, you're good for 10 years. You will not have to get one for 10 years. But if they find something like a polyp, which is a precancer, they'll remove it and make sure that there is no cancer cells in it, and you may have to come back sooner, 3 to 5 years instead of 10. But on that visit, if you're clear, you're good for another 10 years. We generally stop doing them around the age of 70, but this is a case-by-case basis, and if you're relatively healthy with a long lifespan, you may continue to get them every decade. I want to talk to you about some of the treatments we have for colorectal cancer. I'm going to focus on rectal cancer because we've had some exciting new developments. For patients with a very specific type of colon cancer with a specific mutation of mismatch repair, we found that immunotherapy in the form of an oral medication cures the cancer without chemotherapy, radiation, or surgery. There was a study published in the New England Journal of Medicine showing patients with fairly advanced rectal cancers were given this medication, and the tumor resolved in over 90%, nearly 100% of patients given this medication. We don't have long follow-up, but more studies are being completed, and we are going to hopefully have a less invasive way of treating colorectal cancer. Now again, this is not for all colorectal cancers, this is specific to the ones with this mutation that I mentioned. Another option for patients with a locally advanced rectal cancer is organ preservation. Organ preservation means we treat the cancer without removing the rectum surgically. How this benefits the patient is that they're able to continue to have good bowel function, it preserves sexual function, and quality of life is improved. How we do it is we give chemotherapy and radiation together for about 5 weeks, then we give additional chemotherapy, and then you're surveyed with MRIs and colonoscopies and biopsies if warranted. If there's no regrowth of cancer, we continue to follow it with surveillance. This organ preservation method is also called watchful waiting, because if anything does come back, then we can salvage it with surgery. Studies have shown cure rates with this are as high as traditional treatment with surgery. About 50 to 60% of patients will be able to avoid surgery with this treatment. Please do ask your doctor if you have colorectal cancer if this is an option for you. Finally, for locally advanced rectal cancer patients that have to get surgery, we have a new treatment called TNT, which stands for Total Neoadjuvant Therapy. This means we give all the chemotherapy and all the radiation up front. It's much better tolerated to get all of the treatment up front before surgery. In the past, we used to give a shorter course of chemo and radiation therapy up front, then you would get surgery, and then you would get additional chemotherapy. People were very tired after undergoing chemoradiation and a big surgery that most of them did not complete all the cycles of post-operative chemotherapy. So we found that if people get treated with this TNT approach, where all the chemotherapy and radiation is given before surgery, they're better able to complete all of the treatment that's indicated for them. They've studied this compared to standard preoperative chemoradiation, and they found that this improves the chances of being cured from disease. I'm using this routinely in my patients, and I'm finding the outcomes to be much better than the past. Their tolerance of the treatment is much better. If you tolerate the treatment and get less side effects, your quality of life is better, and we have a better cure rate. This is a win-win. So please do talk to your doctors if you have colorectal cancer about this option called TNT for rectal cancer. Thank you so much for listening, and remember, once you turn 45, you got to get that colonoscopy.